Hi, my name is Alex. I work with Health Benefits here in Reno. In this short video, I was going to go over Medicare options for people in rural Nevada. I don't think that rural Nevada is focused on enough by insurance companies. Insurance companies are really interested in Washoe County and Clark County. But in rural Nevada, there are options out there for people living in Elko and Winnemucca and Tonopah and Ely and outside of Reno and Las Vegas. So let's go over some of those options and we'll see if one of them might work for you. So, just briefly, the differences between a Medicare supplement and Medicare Advantage. I'm going to go over both today, but it's important to know the pros and cons of each. Now, Medicare supplement plans usually have a monthly cost. That cost usually goes up as the years go on. In exchange for that monthly cost, there's usually a little to no cost when you go in and use the medical services. And so you might have a small deductible, or you might have small copays when you go in and use the medical services. But those are the two balances that you have. You have a higher monthly cost so that you pay less when you go in and use the medical services. Also, Medicare supplement plans might have little to no copays, and that's a good thing to have. Now, on the other hand, Medicare Advantage plans, many of those have little to no monthly cost. And then when you go in and use the medical services, you might have copays and coinsurance amounts. The Medicare Advantage plan that I'm going to talk about today is called the MSA, or Medical Savings Account. Now, this is available to all counties in Nevada. And so I think it's especially valuable in the rural counties because it's not something that has been offered before. And it's something that a lot of my clients outside of Washoe County and Clark County are taking a close look into. Now, some of these plans give you $2,000 to $3,000 that is deposited for you to spend on medical services. And so that is deposited for you specifically from Medicare. And so it's important to take a close look at these because that's not something that's been out there before. Now, medical savings accounts are a type of Medicare Advantage plan. So this is Part C. You would still have Part A and B through the federal government. You need to continue to pay for Part B. And then this is Part C. And so some of these medical savings accounts that are out there have no monthly premium, as I mentioned, no monthly cost to the plan. They do give you a preset amount, maybe $2,000 to $3,000, that would roll over from year to year. That amount is yours to either save and roll over. You can invest it, or you can use it. You can spend it on medical services that you incurred during that year. Now, you might also, in this plan, you got to keep aware that there is actually two parts to the medical savings account. So if you're familiar with the HSA, Health Savings Account, for people underneath 65 years old, this is very similar to that. So it's basically a piggy bank that you would use to spend on medical services in combination with a high deductible health plan. And so that medical savings account portion of it is the $2,000 to $3,000 that you can spend on medical services. It needs to be spent on qualified medical expenses. And so the list of those is approved by the IRS, and I will include a link below as to what those specific services are. But you cannot spend it on things outside of medical services. That goes in combination with the second part, which is a high deductible health plan. Now, sometimes there's a gap between the amount that they're going to give you and where the high deductible health plan kicks in. So on one side of the fence, you might have a $2,000 basically piggy bank to spend on medical services, but the high deductible health plan might not kick in until after you've spent $5,000, for example. So you might have a $3,000 gap in there. And so let's talk about that a little bit more in detail with the specific plans. Please contact us if you need a further explanation about how that works and the nuts and bolts of you getting on the plan, if that would be right for you. Finally, doctors using MSA. So in the rural counties, doctor access has always been a little bit of an issue, and that's probably one of the main reasons why only one plan is offered in the rural counties in Nevada right now, is because there's not enough what insurance companies call network adequacy. So that's the ability to find doctors in rural areas. And so the MSA works a little bit different. You would actually ask the doctor if they accept the Medicare reimbursement rate. If they do, great. The medical savings account can be used to pay for that service. If they do, but they might charge a little bit more, they can charge up to 15% more. Or every doctor is free to not accept Medicare reimbursement rates. And many doctors say, we're not taking any new patients on Medicare. That's their option. It's a free market. They can do that. However, a lot of doctors, this hasn't been explored with them before, and it might be something that they would be interested in accepting. So that's good to see. This is not a different doctor's list of what you'll see on a Medicare supplement. Now, just because you have a supplement, let's say the other side of the fence, you're not getting more doctors to accept it because you have a supplement. The doctors are still restricted to only receiving what Medicare pays them. And so that is a more limited, what we call fee schedule. That's more limited rate than what private insurance companies pay. And so there's a little bit of kind of nuts and bolts to how the doctor is reimbursed. That's important because this all goes to which doctors are going to accept your plan and how many doctors you can get to accept your plan. So that's something that I would highly encourage you evaluating. I can help you do that as well. So with these plans, you'll also need a separate prescription drug plan. That's similar to Medicare supplements. They need a separate prescription drug plan. The medical savings account, MSA, Medicare Advantage plan I'm talking about right now does also need a separate prescription drug plan. On the other side of the fence, now let's talk about Medicare supplements. Medicare supplement plans usually are an alternative to Part C. So you would have Part A and B from the federal government, the supplement, and a separate prescription drug plan. Now, these can be used with any doctor that accepts Medicare reimbursement rates. And so some doctors, as I mentioned, don't accept it at all. There's not much to do about that. That's it. For the ratings, though, especially if you live in rural Nevada, there's only two rates. There's one for the kind of Las Vegas area, and then there's one for everywhere else. So you're receiving the same rate as everyone in the everywhere else category. So that is definitely an option to consider. You're not going to receive some different rate than based on the specific county or location you live in, unless it's just the Vegas area, not Vegas area. However, these rates do go up every year. And lately, especially on the Plan F, which is no longer offered, the rates have been going up significantly. We used to have in my office upwards of 90% of our clients on a Medicare supplement plan. That is not the case anymore. Here in Nevada, Medicare Advantage plans like the one I kind of illustrated here and those that are similar to it have been increasingly better for members. And so they're offering plans now that they didn't used to offer anything close to. Now, many of them include dental and vision services. Many of them include transportation and meal benefits and no deductibles and no premium. So it's more important now than ever to evaluate these Medicare Advantage options, because instead of paying that high monthly cost for the Medicare supplement, many people are kind of leaving and choosing a Medicare Advantage with little to no monthly premium and just pocketing that money every month instead of spending it on the health insurance plan. So that's an option, something to consider. Now, just briefly, I was going to go over proposed legislation. The Nevada legislature is in session right now. Right now is May of 2021. Now, there are two rules that are important and that are going to affect the people in rural Nevada. One of them is the birthday rule for Medicare supplement plans. This would allow people to switch Medicare supplement plans without passing health questions. Right now, there are only two ways to get a supplement. One is to age in or be eligible for the first time. Let's say you're coming off of an employer plan, or you're turning 65, or you're enrolling in Medicare Part B for the first time. So that's the newly eligible people. Or to pass health questions. And so those are the only two ways to get on to a Medicare supplement plan today. This proposed legislation would allow you to switch Medicare supplement plans near your birthday. So if you were on a Medicare supplement plan, let's say a Plan F, you could switch to another Plan F, or you could switch to a Plan G, and you would do that right around your birthday. Now, the details of it haven't been hammered out yet, so I'll release another video below and go over those. I'll link to it below. Please also be sure to subscribe to our channel. and we'll release more videos on the legislation as it comes out, and both of these rules, as well as more information on Medicare. All that will be available. The second one is the under 65 Medicare supplement. Right now, if you live in rural Nevada and you're on Medicare because you're under 65 and on disability, right now you can only buy a Medicare Advantage plan. And right now, especially in rural Nevada, there's only one Medicare Advantage plan offered. This would change that. So this rule would allow Medicare supplements to be offered to people under 65 on Medicare due to disability. So that would definitely change the offerings that are offered in rural Nevada. So I'm absolutely positive that I did not go over every detail of the medical savings account, MSA, or Medicare supplements, or the different specific plans that are offered in rural Nevada. I would love to go over those with you specifically, or with whoever you're considering by watching this plan or by watching this video. So please be sure to contact me. You can call our office. You can email me. I've got my contact information here. And please subscribe to the channel. If you have any questions, please leave a comment below, and I'll be answering those. So, and thank you for watching, and thank you for your time. I'm Alex Sampson with Health Benefits Associates. Thank you so much.